Our thesis question was, what are the perspectives and effects of vaccinating U.S. citizens from infancy to adulthood?
Our thesis was that all Americans should vaccinate themselves and their children because scientifically, vaccines are the most beneficial option. They prevent the spread of diseases and they prevent many deaths each year. My lens was ethical and I'm discussing borders. Most of the cases of measles in the United States are linked to unvaccinated travelers coming to and from the United States who picked it up in other countries and brought it back here. This shows that all U.S. citizens need to be vaccinated in order to prevent the rest of the United States from contracting a disease from people traveling without getting vaccinated. Another main point is that Canada's system is still paper-based, making it hard for them to track who hasn't been vaccinated and who has. This makes them more susceptible to diseases than the United States. Everyone in the United States needs to be vaccinated, not only to keep the United States citizens safe, but also to keep countries like Canada protected from preventable diseases. Another main point involving borders is Ebola. Although there is no cure for Ebola, it shows how easily diseases can diffuse from country to country, and it shows that borders don't protect us. So, because of this, it only makes sense to vaccinate all of the United States citizens to prevent all of the diseases we possibly can. Sicknesses and death. If somebody continues to skip vaccines, it will make our country more susceptible to easily preventable diseases, such as the flu, shingles, and measles. If people get vaccinated, they can no longer contract these diseases and spread them to others in the community. In Japan, in 1974, about 80% of their population received vaccines for whooping cough. In this year, there were only 393 reported cases and 0 deaths. In 1979, only about 10% of the country was receiving vaccines, and there were 13,000 reported cases of the disease and 41 reported deaths. Once they started requiring the vaccine again, these numbers dropped significantly. Vaccines prevent more than 2.5 million deaths each year. This statistic comes from the World Health Organization. And because of this statistic, many doctors and physicians believe that vaccines have to be beneficial if they save this many lives each year. So it only makes sense for the United States citizens to get vaccinated since they clearly benefit our population. This image on the left shows the number of diseases before the vaccine was implemented, and then it shows the percent decrease after the vaccine, and the number of each disease is on the right after the vaccine was implemented. As you can see, the percent decreases for each vaccine for the disease are pretty high. This image shows how high the reported cases of chickenpox was from 1972 to 2011. Once the vaccine was released in 1995, the number of cases dropped significantly, as you can see there.
So, scientifically speaking, vaccines are vital to the prevention of death and suffering from diseases. According to the CDC, vaccines function as a child's first exposure to disease. This means that rather than a child having to possibly die or be really sick, they'll just have to get a shot. Seems much more simple to me. This graph just shows how many lives have been saved from just the measles vaccine. You can tell it starts at about a little over 1 million deaths per year, and it finishes there at 2016 with 20.4 million deaths prevented. That's a lot of people. Now, there's kind of a hoax that vaccines aren't safe and they'll hurt you, but only about 1 in 2 million people will actually die from an actually vaccine-related death. And that's normally people who shouldn't be taking vaccines that have a weaker immune system. The hoax that they cause autism was spurred around by a guy named Andrew Wakefield, who published an article in The Lancet. It was a scientific paper in England, I think, that he took a super small group of people and they had autism, yes, but it was not caused by it. And this has been supported by quote-unquote evidence that is simply just a thing called spurious correlation. As you can tell, if we're going off the same evidence that they have, then organic food sales are directly related to autism. but obviously not. So, and another reason why this is like not a bad thing is because of herd immunity, and that is what Elizabeth will explain.
Culturally and socially, it's important to know that if the majority of people don't get a vaccination, then more people will catch it and become sick, and it'll just spread through the public. As shown in the graph up there, in that one first part, barely anyone got the vaccine, so they weren't immune to it, so it easily spread to the rest of the public. But in the second part, much more of the public actually got the vaccine, so it was less likely to spread. From the article, should vaccines be mandatory? As many people as possible need to be immunized in order to safeguard public health. If no one gets vaccinated, then it's just going to spread, and then it's just not, there's no point in actually getting the vaccine because it didn't work to help keep the public safe. Also, it's important to know that vaccines are supposed to help one's immune system. So then if our immune system is naturally weak, so then when it comes to fighting off illnesses, our bodies aren't ready and prepared to fight off those diseases and the germs that are inside. From negative portrayal of vaccines, an immunization rate is greater than 90% is required to provide herd immunity protection for a highly infectious disease. It's much like in the graph up there. Before we get the shots, our immune systems are weakened and we don't have good, strong cells. But once we actually get them, it helps to build our bodies up and protects us more to fight off those diseases so we don't actually catch it and get ill with it. That leads to our solutions and limitations. And our first point is that the U.S. government should require vaccines for all people, except people with medical exemptions and allergies. So then unless you have an exemption or an allergy, there should be no reason you can't get a vaccine and not be able to do it. And then the limitation is people who disagree with vaccines will debate this, and chances are they will still refuse.
Another solution would be to release ample amounts of evidence that disprove all of the fallacies that have been spread around, but there's a limitation that some people will still be stubborn enough to believe fake evidence.
Our last solution is to reduce the cost of all vaccines or have all vaccines covered by insurance so that low-income Americans can still be vaccinated. But a limitation to this is that there are people who don't have insurance and even with a low cost still won't be able to afford the vaccine, and therefore they are still left out and not being vaccinated. This is our website.
Okay, I have a couple questions for you. So I'm going to start with you, Alex. So reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem the group identified?
I would probably say Taylor did, just because she had a lot of evidence, and I didn't really think about the whole borders part because a lot of the evidence that I found was mostly pertaining to like one specific country. Because not a lot of groups, not a lot of like big organizations, other than like the UN, really deal with like international vaccine things, and the borders really help.
Okay, thank you. Taylor, next to you. How did the group decide to include Alex's perspective into the overall presentation?
Well, Alex's perspective was like a really big part of our presentation because we were talking about vaccines, and vaccines are a medical issue. So his like perspective and lens really made sense to be incorporated.
Okay, thank you. And then finally, Elizabeth, what's an example of a compelling argument from one of your peers' individual reports that you decided to exclude from your team presentation, and why?
Maybe from Alex is just like some of the extra points that, just going like along the lines of like the autism stuff, because it can be like disproven from other points of view.
Okay, thank you.